Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hey everyone, it's Susan Coffin, and you are listening to Attitude Magazine's ADHD Experts Audio. I don't need to tell those of you who are on the line that ADHD almost never travels alone. In fact, the vast majority of people with ADHD have one or more additional co-occurring conditions such as learning disabilities, dyslexia, anxiety, depression, OCD, and oftentimes these overlapping conditions require independently their own evaluation and their own treatment plan separate from ADHD. And yet, many doctors and clinicians assume that symptoms such as anxiety or depression are just side effects of ADHD. Or on the other side of the equation, they may fail to evaluate people diagnosed with anxiety or depression for attention deficit disorder. The result of this is a really ineffective treatment plans and pretty long-term health risks. They're pretty significant. We are very fortunate to welcome our speaker today, Dr. Roberto Olivardia, to discuss specifically anxiety and depression and offer information on how to correctly screen for coexisting anxiety and depression in patients with ADHD, how to recognize the red flags of an undiagnosed overlapping condition, how depression and anxiety affect ADHD symptoms, and how ADHD conversely can actually lead to or have an impact on depression and anxiety, and finally, how to devise a treatment plan when both conditions exist. Dr. Olivardia is a clinical instructor of psychology at the Harvard Medical School. He's a clinical associate at McLean Hospital in Belmont, Massachusetts. He maintains a private psychotherapy practice in Lexington, Massachusetts, where he specializes in ADHD, eating disorders, obsessive compulsive disorder, and a number of other conditions. We are very fortunate to have him on the scientific advisory board for Attitude, and he also serves on the professional advisory board for CHAD, the National ADHD Advocacy Organization. Dr. Olivardia, thank you so much for joining us today. We're always grateful for your time. Let me just take a moment to mention the sponsor of today's webinar. We are always so grateful to our sponsors. I cannot tell you what they mean to us. They allow Attitude to present all this information that we do week after week at absolutely no cost to our listeners. The sponsor of today's webinar is NEBA. NEBA is a brainwave test. It's the first one cleared by the FDA, and it helps clinicians determine if symptoms are due to ADHD or to another condition. NEBA, along with a traditional diagnostic workup for ADHD, of course, helps clinicians understand better what might be causing a child's symptoms. It may confirm ADHD, or it may prompt clinicians to look for another condition that might be causing ADHD-like symptoms. For more information, visit NEBA online. It's www.nebahealth.com/am. So with that, let me turn it over to Dr. Olivardia with our thanks.
Thank you for having me. And I'm very happy to be presenting this issue because it is one of those topics that often doesn't get recognized. As mentioned in the introduction, ADHD without a comorbid disorder is the exception rather than the rule. In fact, studies show that 80% of people with ADHD will have at least one other psychiatric disorder in their lifetime. And the two most common are depression and anxiety disorders. And for someone who specializes in ADHD and its comorbid disorders, I will often see in my patients various scenarios occur. One where I might have a patient who comes in and they have been diagnosed with ADHD, but the comorbid disorder has not been diagnosed. So recently I had a patient with ADHD who clearly also had OCD, but the OCD was often looked at as being kind of the inattentive aspects of their ADHD, but they weren't rereading the statement because they were inattentive. They were rereading the statement because they had a compulsive behavior that was related to an OCD diagnosis. The other scenario is that the depression or the anxiety has been identified and diagnosed, but the ADHD has not. And I've seen this many times with individuals who come in, let's say depressed, and it's very clear that even at times when they are not in the throes of a depressive episode, there are serious executive functioning deficits. And in fact, sometimes the depression can be brought on because of the failures that might be related to untreated ADHD symptoms. And of course, the ideal scenario is where the ADHD and the comorbid disorder are both fully diagnosed and fully understood, and where the treatment really takes both into consideration, which I'll talk about later. So let's start with depression. Depression is one of those terms that unfortunately is sometimes used in the popular vernacular as this sort of transient sort of experience of, oh, I'm so depressed today, it's raining outside, or I'm so depressed. And it's really not that. The depression is a very, very serious mental illness, a very serious condition that is beyond just feeling sad. In fact, many people with depression will tell you that it's more that they feel the absence of all of their emotions. They feel the absence of everything, really, that makes them feel human. And it's a very, very isolative, very terrifying experience. About 30% of those with ADHD will experience a depressive episode sometime in their lifetime. And sometimes the origin of the depression is totally independent of the ADHD. For some people, depression runs in families, much like ADHD does. So some people, it's a very biological issue. For other people, it could be environmental and situational based upon things that have nothing to do with their ADHD symptoms. And at other times, the depression could be brought on or certainly exacerbated by their ADHD symptoms, failures or problems that might lead to a depression. A patient I'm working with now who is unemployed because of his ADHD symptoms. He couldn't keep up with the work, was late all the time for work. His executive functions were not in a good place. It led to him being fired, and he's having a hard time finding a job and feeling very worthless and developed a depressive episode. But even though that depressive episode is secondary to those ADHD symptoms, it is not secondary in the sense of the impact that it has on this patient. The depression and depression in general really becomes its own entity. It becomes its own beast that then has to, again, still be treated as an independent condition. Having ADHD can have a significant impact on the course of depression. In fact, studies find higher depressive symptomatology in ADHD individuals versus non-ADHD individuals. In fact, when one has both ADHD and depression, the symptoms for both conditions are often worse than what you would see in people who have just one of the conditions alone. Having ADHD is associated with more frequent hospitalizations due to depression, more recurrent depressive episodes, and higher suicide risk and attempts. And if you imagine just the impulsivity that we see with ADHD coupled with what we see in terms of the suicide and suicidality rate of people with depression, it makes a lot of sense. In making a proper diagnosis for depression, you want your doctor to assess the following criteria that I'm going to go through and really make distinctions between a depressive symptom and an ADHD symptom. Because unless you're seeing someone who has expertise or a real thorough knowledge of both, it's very easy for one of these conditions to not be fully assessed or fully diagnosed, or where the symptoms of one are assumed to be part of the symptoms of the other. So these are the slight distinctions. So we see persistent sad or irritable mood. When it's just ADHD without depression, this sadness or irritability is very contextual. It's very environmentally specific. So if I have a patient who's working at a job that clearly is not right for him or her because of their ADHD, if they're working in a cubicle, when they are really the type of people that need to be out and about, salespeople, more verbal, they could develop a depression, but it's very situational, and the depression could be related just to their work life, whereas when they're not at work, their mood is fine, and they're feeling quite happy, and they're feeling free. That is more sort of context specific and more related to their ADHD. So in that case, it would include having a person think really about a career change, and they would be fine. A depression would be something that starts to affect every aspect of this person's life, where they're just in a chronic sad or irritable mood state. A loss of interest in activities somebody once enjoyed is a very common classic symptom of depression. Now, you can ask that question, and sometimes you'll have people with ADHD who do not have depression who would say, yeah, I used to love skiing and now I don't anymore. But you want to be very clear that with ADHD, it's common for people with ADHD to be totally immersed and interested in a certain activity and then just grow tired of it or bored of it very quickly and looking for something new and novelty. That's very different. That's coming out of a place of boredom. With depression, the person is finding no enjoyment in anything. Even the thing that they felt the most passionate about, they absolutely have no feeling or connection to. A significant change in appetite or body weight. With depression, you could see weight gains or losses of anywhere from 20 pounds or more. Someone may suddenly feel a persistent feeling of just not being hungry despite food being all around them. With ADHD, sometimes you can see these appetite or body weight changes, but that are not necessarily caused by a depression if someone just has ADHD. That could be caused, sometimes they're skipping meals because they're hyper-focusing on work or whatnot. They might not be paying attention to their bodily cues because they're so stimulated by whatever is happening externally. That's very different. And again, if you have somebody with ADHD that has food around them where they're structuring their time to eat meals that they're going to eat fine. With depression, you can have the food right in front of you and there's just absolutely nothing inside your body that tells you that you should or want to be eating, or the opposite, or where you're eating and binge eating and eating too much. The same is true with sleep. We know that ADHD individuals have a very hard time with sleep and are very prone to sleep problems and sleep disorders. With depression, it's a feeling of either sleeping too much and too little that, again, is very episodic. So not something that you've always sort of had. With ADHD, I have patients who from the time they were babies had chronic sleep issues. With depression, it could be somebody who has a perfectly normal sleep profile, and then when they're in the throes of a depressive episode, they're sleeping 1-2 hours a night, or they're sleeping 16, 17 hours, and they are still fatigued and tired afterwards. Physical agitation or slowing down. And again, this is not just, we're talking about feeling tired after a long day. And let your doctor know if you are experiencing this in a way that doesn't make sense to you. You know, certainly if you worked a 15-hour day, you're going to be tired at the end of the day. But even if you're engaged in something, and even if you're stimulated in something, people with ADHD typically don't feel that slowing down when they're totally locked into something that they like. With depression, again, it could be the most enjoyable activity to you in theory, but you're just literally wanting to jump out of your skin and feeling just so cognitively slow. A real massive sense of fatigue you see with depression, and questions that your doctor can ask you, is this a new feeling for you, or would you say you have always been someone who felt like you lacked energy? Because many people on the inattentive ADHD spectrum will often report feeling fatigue all the time. So that might not necessarily be a depression. That's sort of part of the inattentive ADD. How have you been sleeping in the last month? Has there been particular stressors in your life lately that might attribute to a sense of fatigue? Certainly, how have you been eating and sleeping? And all of these questions, too, and in really trying to also rule out any potential medical issues that might be at play, things like thyroid conditions, malnutrition, certainly sleep deprivation, to rule out things that might be causing this, or again, depression could be causing these issues with sleep and with eating. What you will classically see are these feelings of worthlessness and inappropriate guilt. Now, the worthlessness, unfortunately, is a common experience for many people with ADHD who can feel that way if their ADHD symptoms have led them down paths where they do not feel successful. So you have many people with ADHD who never experience feelings of worthlessness because they had the right support, they were in the right environments, they picked the right career. But for individuals that have not who have hit sort of dead ends, they might have this feeling of ineffectiveness or worth. What you less likely see with just ADHD is this feeling of guilt, inappropriate guilt, a feeling of guilt of just anything that is going on around you. That is a very classic depressive symptom, to the point where it can almost get slightly psychotic. So I have patients who feel guilty for things that are happening in the world that they absolutely have nothing to do with, almost as if there's just they see themselves as this negative energy and this negative force in the world, which is not that far away from thinking of suicide and thinking of one's life as really not being useful and not being effective. Difficulty concentrating, which is one of those symptoms, again, that is classic ADHD symptom, but is also a classic depression symptom. So when your doctor is asking you that, you really want to help him or her understand, is this something that you've always felt? So you've always had difficulty concentrating in school and this is not anything new? Or you've always been a fairly good math student and had no problem in terms of concentrating, and now suddenly you literally cannot even add 1 and 1. Like you feel like there's just, your mind is molasses, and this is a very episodic experience. Or you notice every 3 to 4 weeks, which depression can happen episodically in cycles for some people, that cognitive slowing starts happening. Or for people who have seasonal affective disorder, which is during the winter months, in parts of the country where the climate gets very cold, where daylight savings happens and you have darkness happening and the lack of sunlight, you'll often see that, again, more episodically. Certainly, recurrent thoughts of death or suicide are very serious clinical matter. They should never be downplayed. And again, sometimes these thoughts could be a result of repeated failures that might be due to untreated ADHD symptoms. But even if that were the case, those recurrent thoughts of suicide are very indicative of a depression, that whether it is independent of the ADHD or part, it doesn't make a difference. It still needs to be treated. And with depression, unlike what you'll see in ADHD, depression can have psychotic features. For people who are severely depressed, can suffer from hallucinations, paranoia, delusional thinking, and don't be afraid to disclose this, even though a lot of people feel shame, they feel crazy. Very, very important to talk to your doctor about this. And as I said before, both ADHD and major depressive disorder run in families, and sometimes, particularly in generations past, people might not have been. You might not have had your grandfather diagnosed with depression, but questions that a doctor can ask is, if you've ever had a parent, a sibling, a grandparent that has either been diagnosed or has ever been hospitalized psychiatrically, has ever received electroconvulsive shock therapy, has ever been institutionalized, has ever attempted or committed suicide, these could be indicators of a depressive sort of biological hereditary factor that just in the past people might not have actually been diagnosed with. Depression impacts ADHD symptoms tremendously by exacerbating all of them. So it's very, very important. And studies find that depression in ADHD individuals can often be caused also by social isolation that can sometimes be because of the ADHD symptoms. In terms of treatment, antidepressants like SSRIs, which stand for selective serotonin reuptake inhibitors, are very helpful for people with depression. They don't necessarily help the ADHD directly, but they can help the ADHD indirectly, in the sense that if you're less depressed, it's just putting that much less of a wear on your brain and all the executive functioning fuel that you need for your ADHD symptoms. But it doesn't ever harm the ADHD. It doesn't sort of contraindicate the ADHD. And stimulants, which are used for ADHD, don't necessarily directly help a depression, but they can indirectly help sometimes by just increasing some levels of motivation. But more for people who are on the severe ends of both of those will often require both of those medications. And cognitive behavioral therapy, which can be very helpful for both conditions, as well as coaching and being very aware of medication compliance. From the ADHD perspective of just remembering to take one's medication and setting up a schedule. For depression, sometimes people forget because they're just so locked into their depression, or sometimes have a lot of stigma and shame around taking antidepressants. I'm going to talk now briefly about anxiety, which is also a very common issue for people with ADHD. And studies show that about 30% of people with ADHD have had more than one anxiety disorder versus only 5% of people without ADHD. And anxiety can come in the form of OCD, generalized anxiety disorder, panic disorder, or various phobias. And it's very important when taking anxiety and stress into consideration that the percentage increases dramatically amongst those with ADHD. Having ADHD itself can cause considerable amounts of stress in terms of the fact that executive functions affect every life domain and can interfere with all of that. But however, it can go beyond that, even aside from all of these things that require those sort of executive functioning sort of pistons in our brain to go off. So issues with worry. And it can be very tricky because, again, you want to be aware of what's part of the ADHD and what can be different. There are hallmarks that we look at that kind of are common threads through all the anxiety disorders. Worry is a very common one, and not just worry about paying the bills or a job interview or things, again, that a lot of people with ADHD will say that they endorse. But if the worry begins to be constant and cause significant distress around other things that even are not related to sort of everyday things, or even if they are about everyday things, but you find yourself in states of panic where you're paralyzed, the anxiety is becoming its own thing. It's becoming its own entity. Anxiety can often manifest in somatic or physical symptoms, cold and sweaty hands, shortness of breath, nausea, muscle tension, erectile dysfunction, acid reflux, migraine headaches, gastrointestinal issues. Those are very hallmark signs that their anxiety sometimes has a way of speaking to us physically. So you want to be very aware of that. Anxiety can make it very hard to sleep. And again, people with ADHD have a hard time falling asleep. But if you notice that what's difficult about falling asleep is if you're worried, then this could be an indicator of an anxiety disorder, not so much the ADD. Irrational fears that might that it's very hard for people to not take seriously. So I have a patient now who feels the need to pray 50 times a day, or else he fears that his mother's going to have cancer, that he has a form of obsessive compulsive disorder. He knows that it's irrational, but the fear that what if it's not is so debilitating that he feels compelled to do the compulsion. Avoidance is a very common behavior of people with anxiety, and being very aware that if you're avoiding situations, now people with ADHD will avoid situations because they fear being bored or understimulated. For anxiety, it's the avoidance is due to a feeling of threat or worry, which is very different. And again, attention and focus highly compromised in people with both ADD and people with anxiety, but being very aware whether sometimes we see the issues of hyperfocus that can be sort of a fluid activity for people with ADD versus being paralyzed or being stuck, which you'll see in the anxiety disorders, where it's almost an over-attention that's disallowing somebody to ever really move forward. They feel just completely paralyzed. And dealing with change. People with anxiety have a very hard time with change in general and transitions, and not just because of the executive functioning stress, but because they fear the uncertainty. And people with anxiety in general have this real intolerance for uncertainty. Whereas people with ADD often can crave it, although there might be an aspect of them that doesn't welcome it because they know there is this sort of reorganization from an executive function level. But once they sort of get through that, they might actually welcome the change. People with anxiety have a very, very hard time with it. Anxiety disorders also run in families, so being very aware of family members that, again, either are diagnosed or might not be diagnosed. Maybe your aunt was housebound and never got diagnosed, but she was, that person who's been in her house for 15 years. That could be sort of those indicators of anxiety. And similar to depression, the treatment for what you would see with anxiety, again, the SSRIs, although they're classified as antidepressants, have many anti-anxiety elements to them. Those are often the first-line medications. And sometimes for sort of quick situations, the benzodiazepines like Ativan can be helpful in suppressing some of the nervous symptoms that people have. However, those do carry a very high addiction potential. So people have to be careful in terms of how they use it, and doctors are very cautious of prescribing large dosages. And for severe anxiety, which can sometimes manifest into paranoia or this extreme rigidity, some of the antipsychotic medications can be very helpful. And again, with cognitive behavioral therapy, which maybe some of the questions will go to, and just general health hygiene, managing your sleep and your eating, it becomes very important in managing anxiety. And really, with all of these things, it's very, very helpful to just have this knowledge of how both of these things just interact. Because I always tell people, when you have two conditions, they will intersect and they will impact one another. And it's very important, although we might be looking at two independent diagnoses, that now that they're coexisting in a way that they will impact each other in a fashion that can be very difficult sometimes to really tease apart. So I will stop there and be open for questions.
One question is about the role of cognitive therapy, both for anxiety disorders as well as for ADHD. Is there a role, and are you likely to find, I guess, a practitioner who can treat both conditions?
Absolutely. That the treatment of choice actually for both would be a cognitive behavioral therapy. So cognitive therapy targets thoughts that we have, our self-talk, and doesn't necessarily work at making the negative thoughts positive thoughts, but they focus on making inaccurate or irrational thoughts into more accurate thoughts. So, for example, if you have the thought, which can occur with depression, let's say, of nobody likes me, I'm going to go to this party and everybody hates me, they think I'm stupid, I wouldn't say that the goal is to think that everybody loves you, because we don't know what people think. So the accurate thought is that maybe some people don't like you, and maybe that, but I can guarantee that not everybody is going to dislike you. And being very aware, and this is where the behavioral part comes in, which is part of that, is being aware of your own behavior. Because if you walk into that room in a way that is not socially engaging, maybe people, let's say, won't approach you at the party, which then could create this self-fulfilling prophecy. And we see the same with ADHD, the self-talk of, I can't do this paper. I'm never going to get this paper done. And so people end up maybe procrastinating, and then, it gets to a point where they might not be able to get it done, as opposed to, saying to themselves, okay, I could get it done, but I'm anxious about it, which might be a more accurate thought. And then as far as the behavioral piece is, certainly with the anxiety disorders is key. If you have an anxiety disorder, you must be doing behavioral therapy. With especially things like obsessive compulsive disorder, with phobias and panic disorder, you need someone who's skilled and experienced to help you do that behavioral kind of work, because you can talk to someone about, why they shouldn't be afraid of dogs, or why touching a doorknob isn't going to kill them. It's not. The cognitive therapy actually tends to be much less effective than the behavioral part. The fact of the matter is, you have to get that person eventually touching doorknobs, and you have to get that person to look at pictures of dogs, and then eventually get them to pet a dog, and figure out, a hierarchy of how to do that. Because part of anxiety is that lots of people will know that it is irrational, but they can't, their body is saying otherwise. So anxiety can't always be talked through, although the cognitive therapy can be helpful when it's mild anxiety, but when it's pretty severe, the behavioral piece is essential.
How does one find would a parent find a cognitive behavior therapist? And one question, someone said, wow, this is such great information. Do you recommend a multi-practitioner approach? So a psychiatrist for medication, a therapist for CBT, a family physician? This is your specific question, I guess. How do you put together a team to deal with more than one condition?
Absolutely. That if you have somebody who, let's say, is a mood disorder or an anxiety disorder expert, but they know very little about ADHD, if the person has the resources, certainly to have somebody have both the kind of depression therapist and the ADHD, and it could be ADHD therapist, ADHD coach. Even if it's hard for people to manage, let's say 2 appointments weekly, maybe meeting, with them on alternate weeks, or if the depression is severe, meeting with that therapist weekly and the ADHD every other week. But keeping them both in the mix is very, very important, because again, when you have both conditions, they will impact each other and sometimes will mimic the other. And it's important for both, let's say if you have 2 therapists, one that's dealing with each, that they're communicating with each other to understand, oh, wait a minute, this isn't the depression, this is the ADD, versus, or vice versa. So absolutely making sure that each of the diagnoses is given the attention, because it does warrant the attention. And I have to say, in my experience, what I've seen is when I work with many adults who have ADD, ADHD, and comorbid disorders, that their experience is that the ADHD is often underemphasized, that
Right.
it's often looked at as an academic issue, even, when they're children, and as adults, it's just looked at as, oh, you have an issue with focus, let me prescribe a stimulant, and then that the ADHD is taken care of. Well, we all know that that's not what it's like, that it's much
Right.
more than that. So it's very important to have somebody as a team. And for children, I will often say to parents, definitely having a team of, if it's like psychiatrists is in the mix, and sometimes for parents, they need their own support, and then definitely having a therapist. And when you interview therapists, asking them, do they do cognitive behavioral therapy? There's an organization, ABCT, which I should know it, Behavioral Cognitive Therapy. I think it's the American Association for Behavioral Cognitive Therapy, but it's ABCT. And they should have on their website a listing of people. But many people, especially these days, because therapy is often more outcome driven. Insurance companies certainly are pressing on having more sort of results oriented treatment, that many therapists are trained in CBT protocols and models that can be helpful.
Okay. Yeah, lots of questions here about how to evaluate whether someone is a good practitioner, whether they're really familiar. I think specifically the problem is often with ADHD. As you say, that's the frequently undertreated issue, right? I mean,
yeah.
Is there any specific, someone's asking on the CBT question, any CBT strategies that you think specifically help for anxiety and or depression and ADHD?
Definitely. I mean, for anxiety and depression, I mean, just a lot of the mindfulness work that is being done in the ADHD community is stuff that's very useful for both depression and anxiety, because all of those mindfulness, the wonderful thing about that, it's really about being present in the present moment. And with depression, people's thoughts are often in the regrets of the past or the things that they're fearing or dreading in the future. With anxiety, it's often the things that people are worried about, in the future, that they're sort of out of the present moment. So both of those things, again, can have sort of their attentional components to it, and certainly with ADHD. So mindfulness practice, relaxation techniques, just tuning into the body, which for anxiety, it's often people who are so externally worried that they aren't tuned in to, oh, I'm hungry right now, I should eat, because their body is just kind of so revved up. People with ADHD are not often tuned into their body because they're more externally stimulated or seeking pleasure in the external environment. People with depression are often not internally, sort of, because they're just feeling almost like a dissociation or disconnection from their body. So really having those kind of relaxation techniques that are very physical, exercise, and it can be very hard for people who are depressed to even think about. But when I say that, I'm not talking about having to go to the gym for an hour a day. I mean, it's literally doing the even whatever the minimum amount that you can do, and working from that can be very helpful. And again, really challenging the thoughts that might run through your mind, that being aware of them, not pushing them away, but saying, okay, if I have the thought that I am worthless, well, let me analyze that thought. What is the evidence for that thought? What is the evidence against that thought? And, would I think, let's say if somebody says, well, I am worthless because I'm unemployed. And so there's the evidence right there, which if you're depressed, your mindset could easily see anything in a way that's going to be skewed negatively. But then I would ask the person, if your best friend or if your sister or your brother were unemployed, would you think they were worthless? Because if it truly is a value or a principle or a committed belief that you have, you should see it across the board. And of course, no patient I've ever worked with would say, yes, if my sister were unemployed, I would think she was worthless. They would say, well, no, because there are lots of people that are unemployed that have lots of, your worth and value is not tied, but they can't see that for themselves. So sometimes it's helpful in a lot of these CBT protocols is writing these things down. There really is a power of documenting what's in your head, because when something is in your head, it has the potential to ping pong endlessly. I mean, forever. I mean, hours and hours and hours and hours. Versus once you write something down, it's just, there's something, it's like anchored. It's the thought is now not ping ponging back and forth. It's just there. Like you almost have to kind of deal with it in a way that it's, because when it's in our heads, there's almost this implicit belief that it can change or morph in some ways if we just think harder about it. That's not going to happen. The thought is the thought. And so it's really challenging a lot of those negative thoughts that people might have. And with anxiety disorders, it's challenging that thinking, but also training the body. So for example, if somebody does have an extreme, like a social anxiety, like a public speaking anxiety, it's, again, coupled with the behavioral work, that the only way that person is ever going to truly overcome public speaking anxiety is they have to publicly speak. And that's the irony with anxiety disorders, is there is no way somebody's just going to get over it without engaging in it. So you have to engage in the anxiety in a way that's not going to panic you, but on a scale of 1 to 10 of anxiety, maybe we'll put you at a level 8. We don't want a 9 or 10, because if you panic, you're never going to be able to tolerate or habituate to the anxiety. But if you are at even a 6 or 7, you'll tolerate it, you'll get through it, and then the next time you encounter that situation, your body has almost said, oh, we've been here before, and we didn't die. Nothing bad happened. We just got anxious. And a lot of times with anxiety disorders, it's people who are getting anxious about getting anxious. It's really what the ultimate, it's just the physiology. So the more that you expose yourself to that stimuli, the less your body sees it as anything threatening, because we are programmed on an evolutionary basis to run away or to fight things that truly are threatening. Like your body will never get used to, if a lion is chasing after you, your body will never be like, oh, I can just take a walk. You know, your body is going to run, or you won't even be able to think about it. But if you're in a situation where your body is sort of doing that, but it's not truly a threat, and you sit with that feeling and that situation, then it becomes easier and easier over time.
Okay. On the subject of cognitive behavior therapy and non-medical treatments, there are a number of questions about things such as hypnosis or other sort of, alternative therapies. Have you experienced with any of those, and what's your feeling, both for ADHD and for anxiety specifically?
Yeah, I've not found any compelling research on hypnosis. I've not come across anything with ADHD and hypnosis, and just my instinct would say that would be ineffective. I don't think there's anything. There's nothing about the way ADHD works and the way that hypnosis would work that would even intuitively make sense to me. With anxiety, I've heard of people who have used it. I haven't come across any compelling research or even anecdotes of people where the hypnosis itself worked. That hypnosis it's not, in a sense, that I could see where it could work in the way that mindfulness can work. That if you're somebody who's going to attend, let's say, to the sound of a clock ticking or whatever, the person who's using the hypnosis might be having you attend to, that's mindfulness. You're in the present moment, and yes, you may find that your body relaxes and you're able to have images, let's say, that might be frightening to you, that enter into your mind. And if your body's in a relaxed state, you now are beginning sort of the imaginal exposure, we call it. Because sometimes for some of my patients, we can't do the real exposures because even thinking about it puts them in a panic state. So we'll start with what we call imaginal exposures. So for my OCD patients, it could be imagine that you're touching a dirty toilet. And just that could put them in a real high state. But then we work at, okay, now let's take a deep breath and bring your anxiety down. And, so I would say the elements of hypnosis that make it work are not exclusive to what you would see with hypnosis, that there are things that very much are subsumed into what you would see with mindfulness or relaxation techniques.
Okay. On the medication front, a number of people have been told that if their child is being treated with medication for stimulant medication, that they cannot also be treated with medication for anxiety or depression. Is that true? And how do those two disorders, or how are they treated with medication at the same time?
Oh, you can definitely be prescribed for both of them. Absolutely. That I have many patients who are on both an antidepressant and a stimulant medication. The only thing that is cautionary sometimes is with the anxiety disorders, that sometimes a stimulant medication could make the anxiety worse. In that I've had patients, for example, who have both ADHD and an anxiety disorder, and they start taking a stimulant, and they'll say, you know what, I'm better able to focus on my work or my schoolwork or what I have to do, but I'm also better able to focus on the things that worry me, and that's making my anxiety go through the roof. Or I'm better able to obsess now on the thing that I'm obsessing about. Then it's not working, and the stimulant almost acts almost in ways that it would for someone without ADHD, like this kind of, it gets them very jittery and very irritable because their system is almost overactivated because of the anxiety disorder. However, having said that, it doesn't mean that because you have an anxiety disorder that you shouldn't try a stimulant if you're interested, because I've also had patients where the anxiety is helped because the stimulant medication is enabling them to focus and shift away from the things that they're worried or obsessing about, and properly place their attention on the things that they want to be attentive to. And the beauty about stimulant medication is that it's, the day you take them, basically how they work. And if your anxiety is ramped up, you can just simply go off them, and it's not a long washout period at all. So I will tell people, if their ADHD symptoms are very, very hard to manage on a non-medication basis and they want to try it, because just, be aware. Maybe don't try it on a day where you have this big work project that you have to do, because there is a possibility that you might get very revved up in your anxiety, but it could also be very helpful.
Okay. Is there one condition that should be medicated or treated first if it's anxiety or attention deficit disorder? Is there an order?
Yeah, it's a good question. I mean, usually you sort of go with what might be causing the more serious impairment. So I would say, like with a depression, that typically that it becomes so impairing that definitely if someone wants to go like a medication route, I would say try to target that first. But for some people, again, the ADHD is interacting with it so dynamically that sometimes both have to be treated right off the bat. But usually you would have someone start a medication, because if you start two medications at the same time, it could be confusing as to what is actually doing what, and is something, if you have a side effect, is it because of one medication or the other? So it's usually wise to start with one. And I would say for most of my patients where depression is in the mix, that's usually the one that they tend to start with, because an SSRI can also take up to 2 to 3 weeks before someone really feels relief from the symptoms. And because you have, for a number of the patients I work with, issues of suicidality and things like that, there's such a chronic risk associated with it that you want to start them off pretty quickly in that realm. With the anxiety, it depends on how generalized it is. So I'll have some patients who maybe their anxiety is relegated to a very specific thing, like public speaking anxiety. And so they'll say, you know what, I'd rather start the ADD medication first, because that really affects all these executive function domains, and I'm not going to be doing public speaking for a while. But if for my OCD patients, I would absolutely do the medication for the OCD first, because that can get so debilitating. But again, that's not to minimize what happens with ADHD for some individuals. So usually the thought would be, what is causing the more serious impairment, and start with that first.
That makes sense. Still on the relationship between the two disorders and treating them, 3 or 4 people have asked whether treating ADHD with stimulant medications also that same treatment would help anxiety? Can ADHD medication alone help anxiety? Ask one number of questions along that line.
Yeah,
And similarly, I guess people have said, well, if you're depressed because you can't get things done because you have ADHD, might then treating ADHD help the depression?
Yes, that it could help it in an indirect way. So meaning that, typically when we say that this medication can help ADHD, typically that's talked about from the framework of, is the mechanism of action of that medication chemically hitting the sort of receptors of the brain that we know are implicated with ADHD? And in that case, we would say no. However, that when you are less depressed, absolutely, that you're just going to be able to do more. So when you also have ADHD, it's alleviating just more of that burden. But I just caution in saying that just taking the antidepressant certainly isn't going to make the ADHD go away, and vice versa. Taking a stimulant isn't going to suddenly pep somebody up to be depressed. In fact, one of the things that I failed to mention a moment ago is that for people who with ADHD and depression who take a stimulant, so sometimes it can make the anxiety worse in anxiety disorders. In depression, what's very important is that it could sometimes help the depression via the route of making the ADHD sort of more alleviated in such a way that it just provides more sort of energy and fuel that can help somebody muster up the motivation that they need, because depression can zap people of their motivation. So it's almost like you just have more motivational energy. Doesn't mean you're suddenly given that energy, but it just makes it less effortful. However, for patients who might be at risk for suicide or might have suicidal thoughts, it's very important that the stimulant medication not sort of either create what's called an agitated depression or an irritable depression, which could almost give the person who's depressed more energy, but they're still feeling stunted and flattened and blunted. So now they're just almost feeling like they want to jump out of their skin. And I presented last year at CHAD about ADHD and bipolar disorder, which would be a whole other webinar that we could do. But 20% of people with ADHD have bipolar disorder, and stimulant medication can throw some people into a manic episode.
Wow.
But if somebody has a suicidal ideation, what most people don't know is that most people, when they are depressed or who have bipolar disorder, commit suicide. They're most likely to do it when they're just coming out of a depression, not when they're in the throes of the depression. Because when someone is in the bottom of their depression, they are almost so cognitively vegetative that they can't even think through a plan. They have no energy to do a plan. So if you have that suicidality and you have now the energy to carry out the plan, but you're not yet at the place where you're out of the depressive darkness, then that could be dangerous. And so very, very important to just have your doctor assess whether it's for you or a loved one, are there suicidal thoughts here? Not everyone who's depressed has suicidal thoughts, but many of them do. And so you just want to be very cautionary around that.
Okay. So yeah, I agree with you that talking about bipolar would be a great topic for another webinar, because I think it does come up a lot, the overlap between the two and the difference of diagnosing one from the other. But on the subject of being treated with Wellbutrin or other SSRIs for ADHD, so I guess what you're saying is it might help by getting rid of the depression symptoms, but it's not directly addressing ADHD.
Well, and I'm glad actually you mentioned Wellbutrin, with the exception of Wellbutrin. So Wellbutrin is what's called an atypical SSRI. So it's not in the typical family of like your Prozac, Luvox, Zoloft, Celexa, Lexapro. Those are all in the typical family. So those do not have properties that have been FDA approved to alleviate ADHD symptoms. Wellbutrin, which I'm glad you mentioned, Wellbutrin is an atypical SSRI which has been FDA approved to target certain ADHD symptoms. So that is, sometimes doctors will prescribe Wellbutrin, which is an antidepressant and approved to treat ADHD. And some people can just take that one medication and have an alleviation of both of those conditions in terms of symptoms.
Okay, interesting, because we do have someone on the webinar who specifically this child was unable to stay on stimulants and whose doctor prescribed Wellbutrin. Yeah, that's where that came from. That's fascinating. Just before we leave the question of alternative therapies, homeopathy, anything. There's always a search, I think, among our audience, which I understand completely, for treatments which are non-medical, non-pharmaceutical, if you will. Fish oil has been asked about, homeopathy, anything that you would
I mean, I would say the jury is out. I mean, I don't necessarily negate the potential of some of those things like acupuncture.
Right.
Absolutely. That my sense and what I've seen with patients of mine is that when it's on the mild spectrum, like a mild depression, a mild anxiety, I have seen people anecdotally say that they were helped by things like acupuncture, massage therapies, things like that. When you get to the moderate to severe levels, I've never seen it helpful. I've just not seen it be something that's really been effective. Now, I don't poo-poo it. I mean, I just, I would like to see, and I think, unfortunately, there's such a quandary because there isn't a lot of research funding for those kind of practices, so we don't have the data, but I think that there is value in certainly looking into that. I mean, I've never seen anyone be harmed by that, with the exception of people who are told that acupuncture is going to be the thing that works, and because of that, they're not exploring or connecting to what we do know works, and that can be harmful. So it's always fine to do some of these other things as long as you are very aware that the data really isn't there that shows a full alleviation of these. But with cognitive behavioral therapy, I should say, I mean, studies show that for mild or even moderate anxiety or depression, that CBT is just as effective as medication, and in some studies find it could be even more effective. When it's in the severe end, the studies show that both CBT and medication is the most effective. So then either one alone.
Yeah, the research on CBT is so strong, that it really is the most effective treatment for anxiety. And I guess it just seems to be very hard for our web visitors to find a good cognitive behavior therapist. I think that's the challenge. Here's a specific question that's interesting. I have an 8-year-old with both anxiety and ADHD. She tends to be extremely overreactive. Everyone noticed that her reactions are out of proportion to the situation. Is this from her ADHD or from her anxiety? Her mother is feeling perhaps she's not on a strong enough ADHD medication. Do you have a point of view on emotional overreactivity?
Right, which we definitely see in ADHD, that people with ADHD often have, you often see hypersensitivities emotionally or even physically, like things like allergies and sense of smell and things like that. Or you have hyposensitivity, individuals who are almost are underreactive to certain situations. And then with anxiety, it's the same thing. That in a lot of ways, and again, sometimes it may not even make a difference in the sense that the treatment might be the same, but if it's ADHD, you'll often see it unresponsive to the sort of anxiety techniques that you would see, like relaxation. Like a lot of times when people are that have that overreactivity when it's anxiety related, it's because there's almost this sense of threat that they have, or this sort of startle response that sometimes people can be trained to have less of that, response. So, for example, if if even just someone walking in a room just would normally have you, jump, that you can do behavioral therapy of just having people randomly walk into a room and just monitoring sort of how your body is sort of reactive to that. With ADHD, it can be very difficult for people to habituate to that. I mean, the truth is that some of us are just wired that way, that, and it may not even be related sometimes to this thought of worry or threat. It's just this kind of way that the body, the nervous system is just sensitized on a consistent basis. Whereas with anxiety, you'll often see it maybe situational with certain, like watching horror movies or things like that. And then with anxiety, you have an anxiety disorder, which are these collection of symptoms that are relegated to a certain situation or a certain venue. But then you also have individuals who just have this kind of anxious wiring that isn't necessarily a disorder, but they're always people that are just going to be on that spectrum, where they're more likely to worry and they're more likely to, and it's not necessarily clinical in that end, but they're just always that kind of individual. And they might have been even as babies that you might have seen that sort of response. That's someone where it's just in their wire. They didn't learn that. That's just kind of in their biology. So with that, it can certainly be an issue with both. If it is an issue with just the ADHD, even the stimulant medication often doesn't, I've not help it really. Because again, it's just the way that the body is attuned. In fact, sometimes a stimulant medication could just heighten it, because if you're that much more attentive, people who have that overreactivity are almost hyper attentive to certain stimuli. So the stimulant medication doesn't necessarily make it better. I wouldn't say it makes it worse. It just kind of makes someone that much more heightened to it.
So many wonderful questions here. And this is from a parent, and she says, can you just give us sort of some real obvious tells that we should look out for as we see our children's behavior, and to suggest that there's a comorbidity going on?
Sure. I mean, with depression, certainly if you notice any withdrawing, social isolation, them preferring to spend time alone, even when they have the opportunity to be with friends or to do something fun, things that they really enjoyed that they're no longer enjoying, and not gotten replaced by something else. So it's almost as if that there isn't anything that they really find pleasure in at all. Certainly, if you hear deprecating statements or negative statements, and it can be tough, because in adolescence you'll see some of these things that where adolescents start to get very critical, start to be have negative body image, have issues socially and whatnot. But again, just because even if it is a part of adolescence, it doesn't mean it doesn't warrant, attention. But even seeing things like that, their self-talk, like, oh, I'm so stupid, or, oh, like those kind of things you just want to be very watchful of. And again, it's very important to know your own genetics, because they're highly heritable. I mean, genes play a very large part in this. If you or your spouse has any history of depression or anxiety, or anyone in your family, it's just something to be that much more attentive to. With anxiety, it's avoidance. If you notice the person saying, oh, I'm not going to go to that party, there's going to be too many people there. And a lot of times parents unintentionally, because they care for their children, they might accommodate that anxiety in a way that actually could be not useful for the child. By saying, oh, don't worry, I'll do this, and this, or I'll go upstairs and make sure nobody. I'm treating this girl who's 15, and she's afraid when they go back in the house to go up to the second floor for fear that a burglar might be in the house. And so the mother says, well, I'll go upstairs and check for you, because she doesn't want her daughter to have a panic attack, which I understand, except the daughter now is not learning to tolerate her own anxiety and uncertainty, and it just makes the anxiety worse. So an accommodation of the anxiety actually will often make it much worse, and somebody's tolerance for dealing with the anxiety much worse. So avoidance is a big part of anxiety. Certainly, again, those somatic symptoms that all of a sudden are starting to come, migraines, acid reflux, the GI issues, constipation, those things are ways, especially for younger people who have a very hard time articulating that they might be feeling anxious or worried, it's going to come out in their bodies.
Dr. Olivardia, thank you very, very much for your time today.
You're welcome.
We're right out of time. Once again, just remind you about our sponsor, NEBA Health. And thank you all very much, and have a great afternoon. Bye now.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.